actually a plastic surgeon, but I am dealing with the hair restoration surgery since 2003. It makes it 18 years. For 18 years, I'm doing the hair restoration surgery. In the first years, I'm doing the FUT surgeries, strip excision surgeries, but since 2010, I'm just doing FUE procedures. I mean, I'm taking grafts one by one. I'm very happy with my job because I know what is the importance of hair for a man. After I see this and I realize that one, I just doing this kind of surgeries, and I stopped doing any rhinoplasty, mammoplasties, etc. I'm just doing this job. I dedicated myself to hair restoration. How we start this FUE is just because of the complaint of the patients. They are coming us and they say to me, "Doctor, you do a good job, but I have a scar on my back, on the neck. That's a smiling face, smiling man. Its scar is just bored me, or a problem for me. I couldn't use my hair, it's shorter." And then we start to do FUE technique, because I know it's a complicated issue that I have to stress on this. FUE is not a scarless operation. There is very tiny scars on your back, but it's just tiny, just point of scars. Couldn't understand. It's not noticeable, so patients may use the hairs much shorter. Who is coming from the abroad, I mean from Europe, Canada or USA, I have to say that you have to choose very good centers. You have to choose your personal doctor. First of all, you have to look at the medical license of your doctor. You have to check whether you will have an operation with a doctor or not, because almost 90% or more than 90% of the centers in Istanbul or in Turkey, let's say, the operation is done by only technicians. Maybe some doctors seeing you and just shaking your hands, giving you some information, but in the operation, they will disappear and only technicians doing the job. So please be careful about when you are choosing your centers. Find your doctor, look at his credentials, and look at the before and after of photographs, and ask them what they are doing during the operation. Just they are taking your hands and going out, or doing something during the operation. It's very important. Check this. Yeah, actually, if you look at the ISITRS website is very good guide for you. International Society of Hair Restoration Surgery website. You can look at your doctors, whether they are assigned there. I mean, if they're a member of the ISITRS or not. It's a very good point of view for you. And what ISITRS said is, if you are a hair surgeon, you have to extract all the grafts one by one, by herself or by himself. The doctor should do or must do, and do channels. If you make an insertion into the skin, like making injections, these kind of things should be done by doctors, licensed doctors, medical doctors. What I'm doing is I'm just extracting all the grafts from the donor side, one by one, and sometimes I do channel creation and sometimes I don't, because my medical team is very experienced on this, creating the channels and putting the grafts, implanting into the channels. So much experience, more than 10 years, and all of these things is under my supervision. But what I am doing is very important part. First, half part of the operation is done by me. This is extraction of all the grafts without any transection, any harm to the grafts. Is very important. Number is very important, you know. No. If you are extracting grafts from the back side, from the donor side, or your bird or chest, and we are putting in your skin, and if they grow up, they will your own hairs. Your body will not refuse them, do not reject them, and they will grow up, and it's a part of your body. Think about it. If patients come into my office, the bald area is very big area. Let's say all scalp area is approximately 100 centimeters square, but the patient has been lost approximately 3,300 centimeters square, so we need much more grafts. But the donor area may be weak, the density of the donor area may be low, so the graft number that we can able to harvest is maybe very less to restore all the area. Then what we can do, we can have to choose other donor sites for the skull. Number one is the bird area. I mean, we are getting the birds follicular grafts, follicular units from the bird, and we are putting on the implanting on the donor side, recipient side, skull. And the second donor area for us is the chest. I'm actually the best restoration can be done by patient's own hair follicles. So it's better to spread all the hair follicles to the large area and use the bird follicular units and chest follicular units for just increased density, and spreading around the native ones gets more natural result, I think. We can use this kind of follicles from the birds and chest, but just by increasing the density. We are not using just one part of the skull, empty part of skull. Rather than we are spreading over the area. Simply, please do not afraid of to have this surgery. This surgery is under local anesthesia, and most of the time I know that you're just afraid of to have local anesthesia pain. But the pain is very tiny pain, just flickering pain or very little burning sensation. It passed away in a second, and you will have all numb area, and you will have no pain after the operation. You will not have any sweating on your face. But just what you have to take care about is just find the right person, right doctor, right center. You have to choose not a center that's giving lots of money for the Google AdWords, but you have to find an experienced hands of the surgeon. It's very important, and please look at whether the doctor is a member of ISHRIs or not. It's very important. Thank you very much. We are waiting for you to Turkey for just join and have a hair surgery together.